everyone. We are so excited that you've joined us for our Lymphedema Patient Roundtable. These are monthly get-togethers where we talk about lymphedema and all things about lymphedema, ways to manage the condition physically, mentally, emotionally, even spiritually. We are here because we care and because we want to root you on in your lymphedema journey. Some of you are joining us tonight because you saw a post on social media. Some of you received an invitation because you received a Lympha Press in the past year. Whatever brings you here tonight, we are here to help, encourage, and inspire. My name is Brenda Viola. I work for Medical Solutions Supplier and Lympha Press. We're the company that provided your pneumatic compression pump. You may have some questions about that. I want to encourage you to feel free to go into the Q&A and ask questions, and we'll try to get to as many as we possibly can. I want to first introduce our wonderful panelists who aren't just here to pontificate about something they don't understand. They live this every day. They understand lymphedema and the particular challenges that people with this chronic condition face. So, without further ado, and I don't know how they're showing up on your screen, but this is how they're showing up on mine. I've got Kelly Bell, veteran fighting lymphedema. We're so glad, yes, we're so glad to have you joining us here. Kelly is a veteran. He is also a gentleman that struggled for many years to get a diagnosis. And when he finally did, boy, he became an advocate for the condition, for raising awareness, and even, taking a real leadership role in the lymphedema community to inspire and help get legislation passed to help the lymphedema community. So Kelly, we're so glad you're here today. I'm going to go quickly to my new best friend, Angela Jones. Angela has one of the best smiles in the world, and
thank
I talked to her recently. You're awesome. First of all, she's a certified health coach. She has lipedema as well as lymphedema, and she is managing her condition successfully, and she has lots of wisdom, and she says she's even got some tips and tricks to share with you tonight. So we're going to get to that. Angela, we're so glad you're here tonight.
Thank you.
Mary Kastelberg is a primary lymphedema patient, and she also represents Lympha Press. But she's been managing her condition for years. She's had surgeries in the past. She brings a unique perspective, and we're so glad to have you with us, Mary Kastelberg. You will see an L in an orange square, and you're saying, is that a mystery guest? And I'm here to tell you it is Betty Westbrook, who not that long ago gave birth to the most adorable little baby boy who happened to start crying right before we went live with the webinar tonight. So Betty Westbrook, who is a certified lymphedema therapist, will be joining us. Soon you will see her face pop up instead of that orange square with an L in it. And finally, last but certainly not least, many of you know him. He is a celebrity from his time on The Bachelorette and Bachelor in Paradise. But more than that, we know and love Cam Ayala because he is a truly passionate advocate for the lymphedema community. He has primary lymphedema. He has had surgeries. He has been managing his condition pretty much all of his life as soon as he got a diagnosis when he was a young boy. And I always love to hear from Cam and his wisdom. So we've got a lot of different, very interesting panelists. We've already got some questions coming in. And interesting, Cam, I want to start with you because you had recently had surgery. And by the way, the last time we did a roundtable, you were in a lot of pain and you plowed through that pain. You can watch Cam's interview that I did with him on the Lymphedema channel on YouTube or also on our website. This first question is from Sheila Trust, and she is scheduled for surgery, cervical spine surgery. And she was told that she will have lymphedema press caps for her legs when she is in bed. She wondered about using Lympha Press at home during her recovery. Now, we want to say we're not offering particular medical advice. We always say, talk to your doctor. But you can share your own personal story, Cam, about how you did use your Lympha Press during recovery.
So just to get everyone caught up to speed, in early December of this past year, December 2nd, I had a bout of infection in my right knee, and my right knee is also the same extremity where I experience my lymphedema. I'm unilateral, so it's only isolated to my right leg, so I don't have any upper extremity or swelling in both my legs. So it's just my right leg. So this leg has had a lot of fun, and by a lot of fun, I mean a lot of surgeries and bouts of infections, unfortunately. So this past December, when I was undergoing surgery for a bout of infection, they had to go in and clean out the knee for the septic joint and bone. As I was recovering from surgery in the hospital, I was having really, really bad pain, to the point where even the IV pain medicine that they were administering, things as strong as Dilaudid and morphine, weren't really making any type of alleviation of that pain. So I reached out to one of my internal medicine physicians who was making the rounds and was familiar with my case and my lymphedema. And I asked this particular physician, I said, "Hey doc, I'm in a lot of pain. I think my pump may help. Do I have your blessing to use that?" And because he's familiar with Lympha Press and its contraindications and uses, he said, "Absolutely, you can do that." So fortunately, I had my father had it brought to the hospital, and literally within the first 2 cycles of the leg sleeve with the Optimal Plus going, my pain was like instantly gone. And unfortunately, we can't pump all day. I wish we could, especially when you're post-op. But for, whenever your physician deems it appropriate for post-op edema and obviously ongoing lymphedema, I have found the Lympha Press to be a lifesaver, literally more relieving of pain than some of the strongest narcotics that physician can prescribe. So see if that works for you.
That's excellent. Thank you for answering that question. I don't know if anybody else wants to weigh in on using your Lympha Press after surgery. I will say this, the reduced pain is so huge. I know that, Angela, you have both lipedema and lymphedema, and one of the markers of lipedema is pain. Have you noticed that while using your Lympha Press, you've seen a reduction or experienced a reduction in pain?
I have. My pain was primarily in both knees. It started out in the left knee, and then I guess the right knee got jealous or whatever, so the pain jumped over to the right knee too. So both of them were just painful all the time. And I noticed that as I, started using, the order is for me to use it twice a day, an hour each time. And I noticed that my knees just stopped hurting. I can't pinpoint it to say, "Oh my goodness, it stopped this day or that day." They don't hurt. So I think they help. It helps pain a lot.
That is really good to hear. We had a question come in prior to starting this evening. And by the way, many people are still jumping on the webinar. We're just so glad that you're giving us some of your time tonight. We are glad to partner with you to help you manage your condition. After you get your Lympha Press, you're not alone. We're in this together, and we're here to provide support and help. So please do ask your questions. One of the questions I received prior to tonight was from a woman named Lucille Nix. Lucille, I think you might be out there tonight, and I hope that you're excited to get your question answered. You may not like the answer, but your question, and we got another one that seemed to revolve around, am I going to have to do this the rest of my life? Now, lymphedema is a chronic condition, meaning at the moment there is no cure. And the more you manage it, the better your life will be. Mary, I saw you nodding a little bit there. You've been dealing with primary lymphedema diagnosed as a child, managing it your whole life. Is there ever a time when you would recommend someone puts their Lympha Press in the closet?
So I was diagnosed at 12 years old. And at the beginning of my diagnosis, I felt like, oh, if I want to wear a dress today, I won't wear my compression or I won't take care of it. And I quickly learned that that was not the right thing to do. I like to tell everyone that I work with that right now it might seem overwhelming and like there's a lot to do, but it really becomes part of your routine. There might be a time, when you are at a really good size and you're in maintaining where if you want to go on a vacation and you can swim, you don't really need to bring your Lympha Press, but it will be something that you should consider as a friend for the rest of your life. It's there to make sure you feel better. It's there to help you when you do have flare-ups. I always make sure that, I plan out where I'm going to go. Will I be able to have it? I always wear compression. I know that's a big thing. That's a big, sore spot for lots of patients because it can be hard to put on and uncomfortable. But as much as I would like to say, after so many years, you can forget about lymphedema, it'll just go away. It doesn't. But with good management, it's a really small, it's a very significant part of my life, and it's actually a part of my life I love, but it becomes a very small burden because you're just used to doing it.
Mm-hmm. And at least it's comfortable, and at least it's easy to use, just zip it up and press play or press the start button. But does anybody else want to weigh in on this question? And I feel you, I hear you. It is, am I stuck to managing and using therapy and not just the Lympha Press, but compression hose and all that for the rest of my life? Kelly, what would you say to those out there that are watching and they feel maybe a little overwhelmed by the need to manage this condition?
I mean, currently, yes. I mean, that's just the bottom. The straight answer is yes, because there is no cure, but that doesn't mean there can't be. So that's why I'm a huge advocate in trying to get funding and research for all that. But yeah, I mean, as far as using the pump or compression, if you need it, I mean, that's simple compared to especially the Lympha Press. I've had other brands and they're huge pain in the rear. And so this one is much more functional. I have it right over my shoulder in my spare bedroom. But yeah, it's for now, and I live in research. I mean, if you look on the wall behind me on that wall, and there's placards of the lymphatic system all over my bedroom.
Yeah.
Because I want to know everything so I can help doctors and they can help me. And so I know what's going on. But yeah, right now, there is no cure. If we get more funding and research, because there's been a lot of strides in research lately. So I'm optimistic. I'm always optimistic now that I jokingly say they're catching up with me.
Well, I have to say, Teresa Payne just commented, I just got the Lympha Press and I love it, but I love this question from Joe Kidd. And you're absolutely right. I shouldn't assume that just because we sent many invitations out to people that just received their Lympha Press, that everybody who has attended tonight's webinar knows what a Lympha Press is. So this is a great roundtable question. How would you describe, Cam Ayala, what a Lympha Press is?
Well, to kind of just piggyback on the previous question, and I think I mentioned this on our last roundtable, and this is something that I literally regurgitate every single day in the field, whether I'm talking to a lymphedema therapist or ultimately to a lymphedema patient, because it is a valid question. How often am I going to have to use this device? How often am I going to have to wear my compression garment and all the other elements that are necessary to managing the condition? And what I said last time and what I say every single day is gravity and lymphedema don't take any days off, right? Mm-hmm. So you have to very much treat your condition with kind of a risk reward analysis. Okay, if you don't want to pump, what are the risks if you don't, right? But then on the other side, what are the rewards if you pump? What are the good things that you're going to experience? Is it the decreased swelling? Is it just the pain relief? Really, there's a lot of XYZ benefits that's unique to each patient. So I think it's important to consider that when you're considering to pump or not to pump.
So, excellent. The question, what is a Lympha Press? We actually love that question because that means you may not be experiencing yet. And what you don't realize is there is a very powerful, effective way to manage your condition in the comfort of your home. And it's a pneumatic compression pump that, well, Angela, you're a certified health coach and you have a Lympha Press. How would you answer that question for our friend out there who's never heard of Lympha Press?
I would say it's one of the most important tools in my toolbox, really. And I like what Mary said about management, because there is no cure. When you can't get rid of something, you just learn how to manage it. And so I would say it's the thing I have that helps me to manage the swelling, manage the comfort. And I found it to be something that I don't want to be without. I'm going to be flying from North Carolina to Arizona because I'm in both places most of the year. So I'm going to be flying. My Lympha Press has its own luggage. So,
what is mine?
And so I don't want to go to North Caroline, I don't know how long I'm going to be there, but I don't want to go without that tool because I think it's a very effective tool and I think it's a very necessary tool for the management of my condition.
Thank you for
And,
saying that.
and real quick to piggyback on that, on the topic of traveling with your Lympha Press, because it is considered durable medical equipment, double check with most airlines, but I know airlines like Southwest, they will not charge you extra to have it
Right.
as a carry-on, and it doesn't count as an extra carry-on. So you can have, you know, your backpack and your carry-on, and then even a separate suitcase for your Lympha Press, and they don't count that against you because it's durable medical equipment. So check with your airlines, but most of them have the same policy.
And I would say too that Medical Solutions also has a letter that tells why you're traveling with this piece of equipment. And I found from traveling with a previous pump that I hand carried the pump itself on in a small piece of luggage to just put that letter in there because they will open it before it goes through the scanner. So there's that letter there to let them know, okay, this is a very necessary thing that this person has.
And I love the fact that patients with lymphedema are traveling, getting out and about and living life, because that's what it's all about. The reason why. Okay, so you may roll your eyes and say, man, I got to do this and I have to do that. But the ultimate end game is that you get to live your life and improve your quality of life and make your life better. And that's really what it's all about. Thank you for sharing that, Angela. I love that you're all travelers out there. I have a question from Susan Troxel. Thank you for joining us tonight, Susan. She received her Lympha Press and it was ordered from her rehab therapist. Now, when she received the pump, it came with instructions to use it 3 times a day, 1 hour for each time of using it. Her therapist countered this by saying that's too much and use it only 1 hour a day. Now, Susan confesses she enjoys it so much, sometimes she'll do it twice in a row. So is this bad? Again, we want to say we're not offering medical advice, but one of the things that I hear consistently from this panel and many patients with lymphedema is listen to your body, listen to your doctor, absolutely, and listen to your body. And for instance, there are many patients that I've talked to who were originally told that they couldn't use higher pressures, and as they tolerated it, they worked with their doctor, increasing the pressure and started to see better results. So I say stay communicative with your rehab therapist. Share with her or him the experience that you've been having and that it feels good. You're getting great results. Anybody want to add to that?
I think that it's important to obviously listen to your therapist and work with your therapist. But one of the biggest things that I have learned over all of my years is you are the expert of your body, and they deal with so many different patients. Lymphedema is so individualized. So you really have to hone in. If you feel like you do better, there's 3 times a day is completely safe. A lot of times when we have desk jobs or we're very sedentary, we're not getting the fluid movement that we would be if we were walking around. 1 hour in the Lympha Press is equivalent to 2 miles of walking when it comes into the fluid movement. And so if you have a desk job, if you're not working and you find yourself sitting a lot, it can be a really, really good tool to get that fluid moving. So I would encourage you to, sometimes therapists need a little bit of a challenge, and it's not wrong at all to ask questions and question your therapist opinion and say, why do you say this? Because I feel that this helps me in this way.
Excellent.
Yeah. That's an excellent point because, unfortunately, there's no standard protocol across the board that is taught by every single lymphedema therapy certification course. So there's some differing of opinions from therapist to therapist, and that's okay. I mean, I think they all mean well, but as Mary was saying, it's on you to be the expert of your own body and to listen to it if something feels painful. That's what I tell all my patients. I don't want you to experience pain. The Lympha Press is not intended to be a torture device. That's why we wanted to make it easy for you to change the pressures up or down with whatever your body best responds to. So again, listen to your body, and it's okay to push back and ask questions to any of your healthcare providers.
So I'm going to ask you, I'm going to put you on the spot, Cam, because I know you have your Optimal Plus right behind you. And our friend Joe Kidd, who first wanted to know what is a Lympha Press, is still wanting a little bit of clarity. And I think there's nothing better than to just show her. She's asking, are the compression pants also known as Lympha Press? So what we have is a garment. Now your doctor will prescribe the garment based on the extremity that's got the lymphedema or the lipedema. And you can either be pants or what do you got right there, Cam?
So this is the unilateral pant. So this is one that you'll have to talk to your local representative about, but we also have bilateral pants and then single leg sleeves. So this is one that I wear for me because I only have swelling in my right leg and also my trunk, but it's a single garment. I'll show you how easy it is to get in as you guys are talking.
Good. And what's really cool, and we had another question about, is it easier to get into it? In fact, an anonymous attendee said, is there a particular way to be able to put the leggings both on without help? My husband helps me and I worry if my husband can't, how can I do it myself? And I say, anonymous attendee, practice makes perfect. Kelly, you had us, well, Cam's getting into his Lympha Press. Go ahead, tell us your story about getting into the Lympha Press.
I will tell you, when I got my Lympha Press, showed up, getting ready, and used to the other model I had, it was never a one-person game. It was always a two-person game, and I think Cam's already in it, by the way.
Oh,
and
yeah.
so when I came in, my wife come in, and my son's standing over the door. He's 19 and in college, so he's been doing this for years. And this last year, I got my Lympha Press. I came in, I slid in, and I zipped it up, and I had no standing by just in case. And I didn't even say anything. My son says, "That's it." I said, "That's it." I said, "I don't need it." He goes, "Where's this been?" Because he dealt with it for years, trying to use the other machines. And this makes it so much easier. I'm in and out of it 2-3 times a day. I use it for pain, swelling, whatever. But yeah.
Yeah, and some people I've talked to, thank you so much for sharing that, Kelly. Some people I've talked to leave them sort of set up so they can sort of slide in and zip all by themselves. I think your question is a really good one because you want to be able to be independent. I think that's what everybody with lymphedema wants. You want to be able to be independent. And we did create these garments and worked with our manufacturer to make them user friendly. So we love getting feedback because we continue to tweak and make changes and improvements to the different garments. Cam, thank you for doing that display for us. That was awesome.
Well, one thing I say, the ease on is important, but I tell patients, and they can contest to this, the ease of taking it off is actually even more important because especially for lower extremity garments and the pants, you know it's working when you have the sensation to urinate because that means removing fluid. So when nature calls and you're in the middle of treatment, you got to be able to get out of that thing quickly and not kind of out of a straitjacket. So that's also an important feature to consider too.
I love that you said that because I'm on all of these different Facebook groups and we want to encourage you. We have these monthly chats and we want you to attend. Our conversation will be different every month because there's always emerging practices and ways to manage the condition and things that we're all learning, but also all these different Facebook groups and portals where people share their personal experience. And I had to chuckle because someone said, I just started pumping with my Lympha Press and I have to go to the bathroom. And they were afraid. And the truth is, exactly to your point, Cam, that means it's working. That means that the fluid is moving and getting eliminated. So that's awesome. Since your question and your answer, Betty Westbrook joined us back. Her crying baby stopped crying. Yay. I bet you're excited about that, right, Betty?
Yes, we have begun teething, I believe.
Oh no, dun, dun, dun. Well, I want to ask this next question of you, and it was a really nice question, and now the person that wrote it disappeared, but the question was, how do you get lymphedema? And there are actually a few different ways. You could be born with it, or
Right.
you want to share what you know about this as a certified lymphedema therapist?
Yes. as you said, you can be born with it. I always think it's an interesting little tidbit to say that during gestation, so when that baby is growing, your lymphatic system is formed in the first 5 weeks. So there's not much that that mom can do to prevent it. It's just like a little hiccup, much like if they were born with a heart malfunction, that's not the word I'm looking for, but a heart defect or something else in their body system. There's nothing you can do about it. So I hope that anyone who, might be thinking, what can I do to prevent this? Just put your mind at ease. Unfortunately, there isn't anything at that point, but you can have a genetic trait. So you may know that you're at risk of passing this trait on to your child, but that's called primary lymphedema. And secondary lymphedema happens after a accident, an injury, any sort of trauma to the lymphatic system. And the lymphatic system is really, really superficial for the part that's generally injured. There's a deep lymphatics, but usually it's that really superficial lymphatic system that's damaged, and that damaged arm or leg or wherever it is can not work like it was supposed to, and that fluid doesn't circulate and it starts to kind of pull in the hand or the foot. And so it can be cancer treatment, which is the #1 reason here in the United States it's secondary to breast cancer. It can be from a spinal cord injury. A lot of our veterans who end up paralyzed or with war wounds, they often have lymphedema related to those injuries. Chronic venous insufficiency, there's a whole list of things that can kind of lead to it. But if you're not born with it and don't develop it early on, it generally comes later from some sort of injury.
Is it okay to wear socks and pajama pants in the Lympha Press? It feels rough on my legs otherwise. And who wants to take that one?
I'll go
I think you're
ahead.
supposed to, aren't you?
Mhm.
That's what, I mean, I do. I wear long, like I have specific pants and socks I put on to put my Lympha Press on. So yeah, you're supposed to, so you don't build up moisture and stuff in there.
Yeah.
It's recommended that you do, if you feel more comfortable wearing bare legs, we just ask that you clean it after each time. This prevents any cross-contamination, and it's as easy as using a Clorox wipe or antibacterial soap and water on a washcloth, just wiping it down and letting it air dry. But it's actually, it can help preserve the sleeves if you do wear socks and pajama pants. We just don't want you to wear compression garments. So for example, if you have a compression stocking, we don't want you to use that and the pump at the same time. We just don't want to overload the system, and we want to make sure that the compression that your pump is set on is the compression you're getting. If you're wearing a compression stocking or garment on top of that, it may be too much for your body to handle.
Very good. Anybody else want to weigh in on that? I know we had done an instructional video, and the our model had a bare leg, and we're like, no bare leg. We want to make sure that our instructional video shows correctly how to use this. Hey, Kelly, you mentioned that you travel with your Lympha Press, and I had a question come in from the audience. How do you pack for it? How do you pack it?
Well, being Cam, I think Cam's seen it.
Yeah, I've seen it.
Military and electronics guy. I have this Pelican case. It's a ruggedized case that, I mean, they can literally throw it off the plane and it land. In my case, I check my baggage and it gets checked. I don't carry it on, and it's rugged. So that's what I use, and it's because it's not a cheap piece of equipment. And so that's what I do.
So here's what I carry my Optimal Plus in. It's a little rolly bag. It's a backpack too, and it's just got a hard shell on the outside. So like any type of electronic that you're traveling with, you obviously want to make sure you have some sort of padding so you can put, t-shirt, socks, or if you even have bubble wrap. Or also whenever the pumps are shipped to you, they have those 2 foam pieces that it's sandwiched in that comes in the box. I tell a lot of patients, you can throw away all the other boxes, but I would recommend saving those little foam insertions because it's formed to fit specifically around whatever pump model you receive. So save those little foam pieces, but if not, most regular hard shell luggage with just keeping, towels or shirts padded around it should suffice. And again, always recommend carrying it on if you can, depending upon your airline.
So one of the questions I love to ask every month, because we're always learning and growing, is what's the latest tool in your toolbox, or what's the latest thing you've learned about lymphedema? And Angela, you said you had some tips and tricks that you've learned since we last talked. I want to direct you all to our YouTube channel. Angela did a great video. Be a defender of yourself. Be your own advocate. Take your message to the medical professionals, do your research, go in armed. We're here to help and to support you. But Angela, what's the latest tool in your toolbox?
My latest tool is called a Marvelous Slim, and it's from Zimit. And it's a little handheld tool. It has a vacuum on the end, and I use it to help the lymph flow just a little better. It's a very strong thing. I got bruises all over my legs, but I had to learn to use it first, but it really does help a lot. And I use it in conjunction with my Lympha Press.
Excellent. I love it. You know, we want to state that while we know the Lympha Press is very effective and helps in so many ways, there may be many tools in your toolbox. I feel for Kathleen Ernst, who's out there, and she put in a message that she has swelling and pain in her knees and lower legs. She also has diabetic neuropathy. She uses the Lympha Press off and on, but does not receive a relief from pain. She's wondering why. And again, we don't want to get into diagnosing anybody's personal medical condition here, but do you think that it's a matter of the different tools in the toolbox and that finding what's the right fix for her? Betty, maybe you have any ideas on that? Sure.
The answer to that, Kathleen, is more than likely it is related to the diabetic neuropathy, which isn't going to be affected necessarily by the Lympha Press pump or many other compression garments that you're going to wear, because it's a nerve issue rather than the lymphatic issue. Now, relieving some of that swelling can relieve some of that pain. I've had patients in the clinic who also said that after getting some of that fluid off of their legs, specifically in this one patient's feet, she would have shooting pains for a month or two if she was fighting a really big swell up that she had recently had, because unexplained, her doctors could best explain it by saying that her nerves are really kind of overworking, if that makes sense, for lack of better words, that they had been under so much pressure for so long that once she did get some of that relief and get some of that fluid out, then those nerves are really like, hey, what is all this free space? I don't feel compressed. But if that is discouraging to you, I would just say, please continue to use compression and use your pump as long as you can tolerate it within your pain tolerance, so that you can see that maybe if after a month or two of relieving that pain, your nerves kind of calm down and get used to your new normal, so that you can, have a better mobility and just quality of life as far as getting around. So I hope that helps, and see your doctor too if the diabetic neuropathy pain continues to increase.
Yeah.
And keep in mind that you need a lower class of compression when you have diabetic neuropathy. So if it's lower extremity and you're wearing 30 to 40, this was Atlanta question, or not on the test, but like Atlanta point we were studying recently, that any sort of nerve paralysis or nerve injury, diabetic neuropathy is part of this, that you need a lower compression class than what most people would wear. So just keep that in mind in case that's part of it too.
That's a really good tip. And you also want to answer Melita Collins' question about, but if you never had an injury to the area, I guess her question is, where did this lymphedema come from? Okay,
so that is a great question. And I find it very interesting because I just recently had a conversation with Dr. Chen. He's a microsurgeon in the Cleveland Clinic, and we've been talking about this really awesome surgical thing on the podcast this week. And he and I just had this conversation that it is probably primary lymphedema, where your body has to have 100% function to be completely efficient to get rid of your fluid. But if you drop down to 85%, you're still doing okay. Once you get under that 70% of functional capacity or workload, then your body is going to start to see an increase in fluid. And so if it's you specifically, Melita, if you have developed swelling later on in life, you have what's called lymphedema tarda, or you could have lymphedema tarda, which is when you develop it later in life, usually after adolescence to the age 35 or sometimes even older. So that your body probably had some sort of malfunction or deficit in the lymphatic system, and you've been functioning really, really well up until this point, and either age or just a random happening of life kind of just tipped your scale a little bit, and you now could be presenting with swelling that's technically primary lymphedema. So you may not have been born with it, but it can still creep up on you later because your body's just been doing a good job of making do until now.
One thing that's important to note that I have found is lymphedema also can be triggered by hormonal imbalances, whether that be adolescence, which was the case with me, pregnancy, menopause. Any of those changes can be, what is the straw on the camel's back. So as Betty was saying, you might have been able to function, let's say at 68% up until this point in time, and then your body is going through natural changes, and then that therefore triggers the lymphedema. There's actually research too showing that some of these people could have predispositions, and then they have surgeries such as prostate cancer surgery, mastectomies, anything like that, that if their lymphatic system was not at 100%, it could tip them over the edge.
Specifically in this conversation Dr. Chen and I had, one of his patients, him and his wife, got into a passionate discussion, and she slapped him, and he developed lymphedema of the face, but he was already predisposition to it. And for years, his wife felt really guilty, and through imaging and talking with Dr. Chen, they found that really it wasn't her fault. I mean, she did slap him, but he was already kind of on his way.
Okay. That is one of the most interesting lymphedema stories I have ever heard.
I know.
Is the
I'm going to
don't slap
continue.
your husband? I don't know.
I'm going to continue to share it, and then I'm going to make a little clip of that episode of our podcast so I can replay it.
Yes, and we should definitely do a whatever.
Reenactment.
Yeah, right. You know exactly what we're talking about here, because not about being slapped.
Being slapped in the face? I'm like, what?
Not about that. No, but I saw you
I'm blushing.
talking about a triggering event that this latent lymphedema was there, and a triggering event. And yes, full disclosure, Cam was not slapped. He doesn't even have a wife. He doesn't have anybody that wants to slap him. In fact, people want to kiss him. So having said that disclaimer, you fully understand that it could be there all this time, and then something happens, and then boom, it shows up.
Yes. So thank you for the clarification. But so just high level for those who aren't familiar with my story, when I was age 11, that was kind of my triggering event. And, age 11, kind of like Mary and Betty were saying, that's a very hormonal time. And I was growing pretty rapidly for my age. And at the time, my right leg was 1.5 inches shorter than my left. So there was already an imbalance there. And I actually had to get surgery on that right knee because the orthopedic doctor wanted to make sure that it wasn't bone cancer. And I thought for literally 15, 16 years that I just would constantly point fingers at this orthopedic surgeon who did that bone biopsy. He's the reason I have lymphedema. We should file a, malpractice suit. But after educating myself, doing more research, and then ultimately getting IC green, endocyanide green lymphatic imaging with physicians like Dr. Chen and even physicians here in the Houston area, we were able to quickly identify that I did indeed have primary lymphedema. So though that surgery may have kind of expedited or exacerbated, or as we're saying now, tipped the scale to make the swelling symptomatic, it was only a matter of time before I had the swelling present, maybe 2 years later, 3 years later, whatever the case may be. But that's my triggering event to manifest my primary lymphedema.
My trigger event as well was puberty, but what was interesting is during all of the imaging later, they actually found out that I did not have essentially a lymphatic system in my right leg. So they weren't sure how I lasted as long as I did. And most importantly, they found that my left leg, though it's not showing symptoms of lymphedema, is only 57% functioning. So as Betty was saying, that's not that. And for that reason is why I'm, a big proponent of using the Lympha Press to treat both legs, because I have a lot of life left to live. I'm 23 and there's a lot of more changes to go through. So I want to make sure I'm as proactive as possible, knowing that my left leg is not 100% functioning.
We have Diasha Thornhill out there, and she says her triggering event was being tackled during her soccer game at age 11.
Wow.
Wow. And we hope it didn't take you too long to get diagnosed. And we hope that you are treating your condition with Lympha Press. For anybody out there who is hearing about Lympha Press for the first time, may not have one, please do private message me or any of us on the panel after the webinar today. I will be glad to address you and connect you with a compression therapy consultant that can help you, because you can manage this condition effectively. Now, we had some interesting chat prior to starting the webinar, and it was about judgment and how some people might see Mary or Cam and say, they don't have lymphedema, they look normal, they're normies. And then there's the judgment on the other side. You might see someone with large volume and judge them, and you don't even understand that it's not anything they've done. Maybe they got tackled in a soccer game at age 11. But let's talk about, how do we handle and navigate the judgment from people who look at our physicality and make assumptions? Angela, do you have anything you'd like to say about that?
Well, I'm also a registered nurse. I haven't practiced in a long time, but a large portion of that career for me was education. And I believe I welcome people commenting or making comments or whatever, because I see it as an educational moment. And I've even had the opportunity to talk to people. My problem is I see people and I know they have lymphedema, but I can't say anything. So, and that's really hard, because you look and you see the markers and you go, yeah, she's got it. And that's really hard. But I would say, if the opportunity presents itself, to just educate the person on what it is, because there's a tendency to think, oh, that person is just fat, or that person is just this or just that. And it's an opportunity to educate.
Well said. Well
so-
said. Now, there's also embracing and owning your condition in a way that you're not ashamed to say. And we encourage, remove the shame. Absolutely. Mary, we had talked about that. Who wants to weigh in on this judgment issue?
I can just say, before I could get this under control, because mine's actually in my trunk and it causes my entire body to swell. I would run into it all the time. I mean, and even I would jokingly tell my wife, I said, even the grocery store's a battlefield, because I don't know who's going to approach me, because I never knew people would do that. And we were walking along a trail, and her and I were walking. Some guy walked past us, and I just happened to have a shirt on from Mystic Seaport. I'm a retired Coast Guard officer, so I love the sea. And it had a whale on it, and he said, "Whale, how fitting." And I'm like, So, and I used to joke. So rather than people thanking me for my service, which I served for over 25 years, that was how I was usually approached, no matter what I was wearing. And so I literally had to pull my wife off him, though, because I'm like, just keep going. And she's like, no, I'm like, no. But it is. I mean, it is like, it becomes a hostile battlefield. And eventually you just kind of go, I got to live it. And I use it now in my life for motivation for me to I never not use my tools, ever. And one reason I can't, because it affects my lymphedema affects my organs. So I don't. But I just use that for motivation. Like, I'm going to do this. And I also use it for motivation to try to educate, and as an advocate, that's what sends me to the hill, to make changes.
Yeah. We really want to impress upon those of you who cared enough to show up tonight. there is hope. There is help for your condition. There are people that care. There are communities that will link arms with you, that will tell you their tips and tricks. We want to be part of your community. Don't be ashamed of this. And, you know, we don't get to choose what we get in life. Everybody's got something, whether it's lymphedema, lipedema, you name it, fill in the blank. Everybody's got something, but to know your value and your worth is really at the core. And when you know your worth, you will take care of your condition and manage it because you want to live that beautiful life that's yours. We had a really interesting question. And Mary, you said you wanted to answer it live during the webinar. Is it normal to feel anxious during the Lympha Press treatment? And I'm thinking toward any kind of pneumatic compression therapy, even if you're using it successfully. Oh, so here it is. It's going great. My Lympha Press is working. Why do I feel anxious? What's going on with that?
So I was honestly the biggest victim of the measurements. When you go into lymphedema therapy and they measure your legs, I would just stare at those numbers and be like, smaller, smaller, smaller. And they never, you know, sometimes they weren't, sometimes they were bigger, sometimes they were smaller. And I think that it's just, you know, knowing that no matter what the result is, you're doing something good for your body. I think, you know, the Lympha Press, at first it's new and it's very, very easy to use and very patient friendly, but like anything, it can be overwhelming at first. And so I think when you're feeling anxious, just to take a deep breath and saying, you know what, this is going, if I don't see a huge miraculous result, this is helping my body and this is going to help my body. And just taking that time to say, I'm doing something good for myself. This is what I need to do, and the rest will follow suit. I think that sometimes we get so frustrated when we don't see instantaneous results, and then trying something new with lymphedema, you're thinking, well, nothing has really worked in the past. Is this actually going to work? Is this actually going to make a difference? And you get stuck in your head instead of just allowing yourself to take that deep breath and saying, I'm doing the steps that I need to do. And it's honestly, a lot of things for me, I was told maybe don't do this or do this. And you have to find your own way. You have to find your own treatment. Every single person on this panel can tell you that lymphedema is different for everyone. And so you need to go in with an open mind and saying, this is not going to hurt my body. It could really help my body. It could help my body, you know, a little bit, but I might need this as well. And just try and go in as open as possible.
Philip Fox, thanks for being out there tonight, Philip. We appreciate you. Do you recommend having therapy or massages? No, Brenda, massages while using the Lympha Press. And you were enthusiastically, yes, absolutely, lymphedema therapy. We at Lympha Press are huge fans of lymphedema therapists. We work hand in glove together to help people make their lives get better. Did you want to expand on that a little bit, Betty, for the rest of the audience?
I absolutely recommend joining these two hand in hand, because the Lympha Press therapy, no matter if you have the pod, the pantsuits, a arm vest, a jacket, a sleeve, even if it's just one little, you know, below knee component, whatever Lympha Press product you're using, whatever sleeve you're using, I absolutely recommend joining that with either your lymphedema therapy in the clinic, complete decongestive therapy, or doing your self therapy at home. I use the word lymphangiomotoricity, which is like my favorite big word that I know.
You're all super impressed, by the way, and I'm glad you're not quizzing on us on this later.
It's on the midterm, right?
Say that again.
This is on the midterm, right?
You all get an A for attending. It is just the amount of times those lymph valves move, like contract to move that fluid out. So it's like your heartbeat of your lymphatic system. That's exactly what it is. Okay. So if you are doing diaphragm breathing, you're going to increase that. If you are doing self MLD above or like below those regional lymph nodes, you're going to increase that. If you're working your abdominal, you're going to increase that. Short necks, all those little things you can do to open up your channels and to increase that, it's going to help improve the movement of your fluid. Now, I always recommend, if you have access to a pump, maybe pump before you're going in to see your therapist, who's then going to do manual lymphatic drainage and skincare on you and exercise. They will either bandage you up there if that is the treatment phase you're in, or they'll help you get back into your garments so that you take all this energy that you've built up inside your lymphatic system through MLD, through pumping, through everything else, and then you just continue that out so that it kind of takes that momentum and runs with it into your next session. You want to do as much as you can to like hype up your lymphatic system so that you have that long-term effect of moving that fluid out. Abdominal breathing, diaphragm breathing is one of the easiest ways to do that, especially if you have lower extremity lymphedema. My little handy dandy guy back here, you can't totally see it, but the lymphatics come up through the legs and then they meet up here in what's called the thoracic duct. So your legs have separate drainage pathways, and then they meet, and then that goes right through your diaphragm. So as you breathe really heavily, you sing loud, you yell at your kids, whatever you're doing during the day, it's moving that fluid. It's stimulating that thoracic duct. So I'm 100% a fan of adding lymphedema therapy with your Lympha Press therapy to get the best result you can.
And we've got so many questions coming in, and we have a hard stop at 9 p.m. Eastern Standard Time. If we don't get to your questions, we'll make a list of them and we will get back to you after tonight's webinar. What is self-MLD? Judy Beeman wants to know.
So self-MLD is you performing your manual lymphatic drainage. So you can have your therapist teach you, or you can, read out some information, but it is you using your hands to be your own therapist and to move that fluid and to activate your regional lymph nodes.
And Angela, you are the best person to answer this question. Anonymous wants to know, what's the difference between lymphedema and lipedema?
Lipedema is called diseased fat. It's called ugly fat. And it's fat that's there. It's usually in nodules or bulges, actually. And it's not affected by lowering your calories or by dieting or by exercise. You can lose the regular fat that way, but not the lipedema fat. The lymphedema is fluid that you just can't get rid of. I mean, it's just there. And it's because of, like we said before, damage to your lymphatic system. So it can't flow as freely as it needs to. And it doesn't have its own pump. So it's just there and you have to help it along.
So well said. I'm so glad you're a part of this panel, Angela.
Well, I lost my connection. I'm on my phone now because I lost for some reason, I lost it on my laptop. So.
All that matters is you are back. Teresa Fitzgerald, and I want to ask our compression therapy consultants, either Cam or Mary, this. She uses her sleeve. Teresa, you had 51 lymph nodes removed after surgery. First of all, God bless you. We are thinking of you, and we are so glad you have a Lympha Press to help manage your lymphedema. She uses her sleeve at night, but she wants to know, is there a better time, night or morning? Anybody want to weigh in on this?
So on that, for me personally, it really just kind of depends on what your lifestyle is. Me, I drive a lot, and then I'm presenting a lot in clinics. I'm going into patients' homes. So I'm naturally moving my lymph fluid because I walk around a lot, and I'm wearing my daytime compression garments, right? So for me personally, what's most realistic for my work schedule and my lifestyle is to pump in the evening time before I go to bed. So, it really depends on, again, what your lifestyle is. If you're a patient who's retired and maybe you're working from home where you have the freedom and flexibility to get into your device and still type at your computer, or if you're upper extremity, you can read, or whatever the activity level is, there's not clinically proven a right or wrong time of day that is more effective. It's just whatever works best for you. And again, if you're using your Lympha Press as an adjunct to your nighttime garments and or your daytime garments, whatever works best in your compression ecosystem timeline.
That is a great answer. One of the things that's a hot topic on everybody's minds is the COVID vaccine. And I know that there's been a lot of chatter in internet groups about, should I get a vaccine in my lymphedema affected limb? Kelly, you actually had to really lobby your doctor to make sure you got on the list because you did not meet the standard diagnostic qualifications until you showed a chart of what's going on inside of you. What did your doctor say to you, Kelly?
Oh, he said absolutely. And the reason is because I don't have the normal issues anymore. For you, the ketogenic diet helped me change a lot with mine, but I still have pulmonary issues quite a bit that are managed. And so normally I would not be here, but when I actually have had my lymph nodes taken out of the center of my chest, between my lungs, and that along with the fact that my thoracic duct is highly blocked. So that affects, so he was like, oh, absolutely. But still, again, he told me to, when we go to phase 2, let him know. It's just something as a lymphedema patient, especially in my case, I know I'm in contact with my doctor, and he's thanked me for reminding him, because normally I would not be caught by his system. So
excellent. We are not giving medical advice, and we know that there are personal opinions about whether or not to get the vaccine, but in general, getting a shot in a lymphedema affected limb is usually frowned upon. Am I correct about that, Betty?
I would actually like to say that it's controversial, but it has been debunked in some studies. So there are a lot of people who are hard, no, absolutely not. I've had this experience and I'll never do it. And that is their answer. But it has been debunked in some research that I can help share. If anyone is interested, you can contact me.
Anybody? Mary, I saw you sort of nodding a little bit. Or maybe you were just enthusiastic about the conversation.
No, I think that it really depends on the individual, and a lot of people with lymphedema may have comorbidities that would encourage them to want to get it sooner than later. But I think that you really need to look at what is best for you. So Kelly is pointing at himself. His lymphedema actually goes into his lungs, and that is very scary if you're thinking about COVID-19. So for him, it's very practical that he gets his early. I think that it's an individual case basis. It's a new vaccine, which may scare some people as far as research goes. Personally, I think, as we see everyone go through it, then we'll obviously know better answers. But if you have comorbidities that would put you at high risk, I do think it would be a good idea.
So everybody, we are really out of time. I can't believe how quickly this hour went by. If you have questions that went unanswered, if you want information about Lympha Press, please email me, bviola@medsoulsupplier.com. You can also follow Kelly at veteran_fighting_lymphedema. You can follow at Cameron Ayala. You can follow Betty Westbrook. I will put everybody's contact information up on the screen when I edit the graphics in. This will be posted on our website, www.medsoulsupplier, by the end of this week, so you can look it over and say, "What did I really hear that?" Yeah, play it again. It'll be on our YouTube channel as well. You can follow Mary. Angela is still getting her social platforms together, but we hope to lock her down. We want to do this every month. We want to be here for you. You are not alone. And so with that, we all wave to you goodbye. We wish you well. We are rooting for you on your lymphedema journey. Everybody, thanks for being here tonight. Have a great night. See you soon.